Hi, hello, welcome back to my channel, Mom is Nursing Care. Today we will discuss about the maternity nursing and NCLEX practice questions. 25 questions we will discuss. So let us start with the first question. A postpartum patient was in labor for 30 hours and had ruptured membranes for 24 hours. For which of the following would the nurse be alert? So the mother is in labor process, so ruptured membrane, that means amniotic sac is ruptured. So for it's been 24 hours. What the things that we expect is endometritis. Endometritis is an infection of the uterine line and can occur after prolonged rupture of membranes. The symptoms include swelling of the abdomen, abnormal vaginal bleeding, discharges, fever. Any infection, the first sign that human being shows is fever, discomfort with bowel movements, because the endometritis, that means the inflammation or infection of the inner side of the uterus, that may cause the pelvic inflammatory disease also, because it is just lying beside of the in front of the bowel, the large intestine. And pain in the lower abdomen, or pelvic region also we can see in this case. Second question is, a client at 36 weeks gestation is scheduled for routine ultrasound prior to amniocentesis. After teaching the client about the purpose of the ultrasound, which of the following client statement would indicate to the nurse in charge that the client needs further instruction? That means the patient did not understand the concept of ultrasonography. So she requests further teaching. So here the ultrasonography will help to locate the placenta, that is right. The ultrasound identifies blood flow through the umbilical cord, this is wrong. The test will determine where to insert the needle, that is right. And the ultrasonography locates a pool of amniotic fluid, this is wrong. So the correct answer is that only. The ultrasound identifies blood flow through the umbilical cord. This answer is given by the patient. Actually, umbilical cord blood flow can be detected with the help of the Doppler, but not with the help of the ultrasonography. So before doing amniocentesis, so amniotic fluid testing, a routine ultrasonography is usually done to locate the placenta, where is placenta, or to locate the pool of amniotic fluid, where is the pool of amniotic fluid is there, and where can we insert the needle and all. To check these things, they will do the ultrasonography. And also showing the physician where to insert the needle. Color Doppler imaging ultrasonography identifies blood flow through the umbilical cord, but not the USG. Third question is, while the postpartum client is receiving heparin for thrombophlebitis, which of the following drug would the nurse expect to administer if the client develops complications related to heparin therapy? Heparin is an anticoagulant that is given for the thrombophlebitis, inflammation of the veins. So here calcium gluconate options, protamine sulfate another option, methyl ergonovine another option, fourth option is nitrofurantoin. So the correct answer is protamine sulfate. Protamine sulfate is a heparin antagonist. It acts against the heparin. Heparin is a anticoagulant that dissolves the coagulation form or clot form in the arteries or veins. So, but it is the protamine sulfate is an antagonist. It acts against the heparin, and by that it can stop the heparin action on the vein, in the veins and in the artery. What happens if the heparin complications takes place? The patient may overbleed. So there is a chances of hypovolemic shock. So to avoid this one, in case of heparin complications, the protamine sulfate is prescribed drug to act against the heparin. Next question is, when caring for a 3-day-old neonate who is receiving phototherapy to treat jaundice, the nurse in charge would expect to do which of the following? Turn the neonate every 6 hourly, does not required. Encourage the mother to discontinue breastfeeding, not required. Notify the physician if the skin becomes bronze in color, it is not required. Check the vital signs every 2 to 4th hourly. My expected answer is the fourth one. We should check the vital signs for every 2 to 4th hourly. Let us see the answer is check the vital signs every 2 to 4 hourly. While caring for an infant receiving phototherapy for treatment of jaundice. For the purpose of jaundice, we give phototherapy a blue light, blue rays that dissolves the bilirubin, bile pigmentations, and vital signs checking is very important during this period because there is a chances of developing hyperthermia because baby is continuously on the phototherapy light, so there may be a more chances of getting hyperthermia too. We'll have to check every 2 to 4th hourly vital signs of the newborn baby to avoid the hyperthermia complications. And fifth question is epidemic gravida in active labor is about 9 days post term. The client desires a bilateral pudental block anesthesia before delivery. After the nurse explains this type of anesthesia to the client, which of the following locations identified by the client as the area of relief would indicate to the nurse that the teaching was effective? That means the patient is understand the teaching of the nurse. So where that pudental block should be given? The options are back, abdomen, fundus, and perineum. Answer is perineum. A bilateral pudental block is used for the vaginal deliveries. For the normal delivery purpose, this pudental block is given on the bilateral perineum to relieve pain primarily in the perineum and vagina. Pudental block anesthesia is adequate for the episiotomy and its repair. Actually, during the episiotomy and all, this pudental anesthesia will be given by using the LOX 2% injection. Next question is the nurse is caring for a primary gravida at about 2 months and 1 week gestation. After explaining self-care measure for the common discomforts of pregnancy, the nurse determines that the client understands the instructions when she says nausea and vomiting can be decreased if I eat a few crackers before rising. It may be right. And if I start to leak colostrum, I should clean my nipple with the soap and water. We should not apply soap on the nipple. Wrong. If I have a vaginal discharge, I should wear nylon underwear. This is wrong. And leg cramps can be elevated if I put an ice pack on leg. Yeah, this may be right, but it is not suitable in this situation. So the right answer is nausea and vomiting can be decreased if I eat a few crackers before arising. So eating dry crackers before arising can assist in the decrease the common discomfort of the nausea and vomiting. Before arising means arising of the nausea feeling and vomiting feeling. So if we have like some crackers like nothing but like potato chips, so dry chips, so if we have such chips means there is a chances of avoiding nausea and vomiting. These strong food odors and eating a high protein snack before bedtime can help even that also, like having high protein food are like for example soya sticks, that also dry but they are high protein, and having egg or otherwise chicken is also a high protein. So before bedtime that also can avoid the chances of nausea and vomiting. Next question is 48 hours after delivery, the nurse in charge plans discharge teaching for the client about infant care. By this time, the nurse expects that the phase of the postpartum psychological adaptation that the client would be in would be termed which of the following. So while the mother is ready to get discharged from the ward along with the newborn baby, what her attitude is supposed to be means option A taking in, B letting go, C letting hold, and resolution. Taking in is not right, letting go is also not right, taking hold is the right answer. What I suspect, yes, taking hold is the right answer. Beginning after completion of the taking in phase, the taking hold phase lasts about 10 days. During this phase, the client is concerned with her need to resume control of all phases of her life in a competent manner. At this phase, she is ready to learn self care and infant care skills. That means taking go in the that means like okay, whatever it is there, I'll have to go with that only. That mood is there. But taking hold means okay, having first baby, and this is the second newborn baby she had, and she'll have to take care of the first baby and herself and to the newborn baby. That means she got like the confident of taking hold of that newborn baby after 10 days of her delivery. After 10 days of delivery, she will develop an attitude of taking care of herself and also taking care of the infant. She will be ready. That's the meaning of taking hold here. Next question is, a pregnant client is diagnosed with partial placenta previa. In explaining the diagnosis, the nurse tells the client that the usual treatment for the partial placenta previa is which of the following? A. Activity limited to bed rest. B. Platelet infusion. C. Immediate cesarean delivery. D. Labor induction with the oxytocin. Placenta previa means there are degrees are there in the placenta previa. Placenta previa is nothing but the implantation or the placement of the placenta nearby the os is called as placenta previa. The right answer here is activity limited to the bed rest, because she is suffering from the partial placenta previa. We need not to abort the baby, or we need not to expect other complications. So we can just restrict the mother's work. By that we can uh, reduce the chances of separation of the placenta, also abruption of the placenta we can call. By that we can preserve the baby's life till 36 weeks, and after 36 weeks we can plan for the cesarean section either or normal delivery. It depends upon the location of the placenta previa. So far it is a partial placenta previa, so mostly they will go for the LSCS. So here treatment of the partial placenta previa includes bed rest, hydration, and careful monitoring of the client's bleeding. The nurse plans to instruct the postpartum client about methods to prevent breast engorgement. Which of the following measures would the nurse include in the teaching plan? Breast engorgement means when the breast is filled with the milk, that calls as breast engorgement. First option is feeding the neonate a maximum of 5 minutes per side on the first day. Wearing a supportive brassiere with nipple shields. Breastfeeding the neonate at frequent intervals. Decreasing fluid intake for the first 24 to 48 hours. So C is the the correct answer, what I think, because feeding the neonate at a maximum of 5 minutes per side on the first day. Actually, not only on the first day we'll have to feed the baby every breast we should spend at least 10 minutes on each and every breast. This is wrong, and wearing supportive brassiere won't work. The correct answer is breastfeeding the neonate at frequent intervals. As if we give frequent intervals every 2 hoursly breastfeeding to the baby, and every breast we should give feed for 10 minutes. That means every time you give breastfeeding to the baby, 20 minutes you'll have to spend on the baby, each breast 10 minutes and 10 minutes. When we give frequently breastfeeding completely to the baby, what happens that all the milk which is in the breast will be empty by the baby sucking. By that there won't be a chances of arising breast engorgement. Here, prevention of the breast engorgement is a key. The breast technique is to empty the breast regularly while feeding. Engorgement is less likely when the mother and the neonate are together, as in single room maternity care continuous rooming in, because nursing can be done conveniently to meet the neonates and mother's needs. Next question, 10th question is, when the nurse on duty accidentally bumps the bassinet, the neonate throws out its arms, hands open, and begins to cry. The nurse interprets this reaction as indicates of which of the following reflexes. So, accidentally bumps the bassinet means the nurse accidentally hit uh, the cradle, neonate's cradle. So when she hit bumped the neonatal cradle, the hands arms are opened, and baby began to cry. This reflex is actually what that called a startle reflex, Babinski reflex, grasping reflex, and tonic neck reflex. I feel it is startle reflex. Answer is A is the correct answer, startle reflex. The Moro or startle reflex occurs when the neonate responds to stimuli by extending the arms, hands open, and then moving the arms in an embracing motion. Did you observe any time if we take the baby suddenly out of any place, the newborn baby, they will show the startled reflex. So option B, Babinski reflex occurs after the sole and palm and foot has been firmly stroked. When the sole and palms and hands are struck firmly, the Babinski reflex comes out. And palmar grasp reflex will be present around the 16 weeks of gestation, can be elicited in the preterm infants as young as 25 weeks. Palmar grasping means when you give your finger, baby will hold your hand very strongly. That is called as palmar grasping reflex. 11th question is, Epimi gravida, client at 25 weeks gestation visits the clinic and tells the nurse that her lower back aches when she arrives home from work. The nurse should suggest that the client should perform which sitting position. First one is Tyler sitting, leg lifting, shoulder circling, squatting exercises. The answer I think is Tyler sitting. Answer is Tyler sitting. Tyler sitting is an excellent exercise that helps to strengthen the client's back muscles and also prepares the client for the process of labor. Tyler sitting is nothing but keeping your back in a 90-degree angle against your thighs, and also your the legs also should be in a 90-degree angle, and make your back straight. By that there is no strain on your backbones, so it reduces the strain of your muscles and causes less pain. So here the client should be encouraged to rest periodically during the day and avoid standing or sitting in one position for a long time. The pregnant woman should be encouraged to take the periodical rest. That means you should not be in a completely for a long time in a sitting position or lying down position or a standing position, because she is supposed to uh, give the circulation to the baby. 12th question is, which of the following will the nurse in charge do first after observing a 2 centimeters circle of bright red bleeding on the diaper of a neonate who just had a circumcision? So notify the neonate's pediatrician immediately. Check the diaper after circumcision again in 30 minutes. Secure the diaper tightly to apply pressure on the site. Apply gentle pressure to the site with a sterile gauze pad. Correct answer is apply gentle pressure to the site with a sterile gauze pad if bleeding occurs after circumcision. The nurse should first apply gentle pressure on the area with the sterile gauze. Bleeding is not common but requires attention when it occurs. So when circumcision is done, circumcision is nothing but the removal of the foreskin of the glans penis. So the neonates may be having like the phimosis, that means the excessive skin growth uh, of the glans penis, that it leads to the discomfort in the neonate while urinating, and it raises the more chances of UTI, urinary tract infections. So in such cases, the parents and the doctors have to take the decision to go for the circumcision and the surgical removal of the foreskin. So in that case, there won't be any bleeding because it is just a minor surgery. So if is there any bleeding, the first and the foremost thing the nurse should do, apply the gentle pressure by using sterile gauze. 13th question is, which of the following would the nurse most likely to expect to find when assessing a pregnant client with abruptio of placenta? Abruptio of placenta means the separation of the placenta before reaching the term pregnancy. That means that 36 weeks priorly the placenta is separated from the uterine walls, so that is called as abruptio of placenta. What happens if abruptio of placenta is there means excessive vaginal bleeding may be present and may not be present, but sometimes it may be like back of the bleeding may be present in the back of the placenta, and rigid and board like abdomen, it may be the right answer. And tetanic uterine contractions, so uterine contractions will be there but it is not tetanic, and premature rupture of membranes won't be there. The correct answer, let us see, the rigid and board like abdomen. The most common assessment finding in the client with abruptio of placenta is a rigid or board like abdomen, because the uterine contractions will start. So the rigid and board like uterus we can observe in the abruptio of placenta. And pain usually reported as a sharp stabbing sensation high in the uterine fundus with the initial separation also is common. So if initial separation, if slightly separated placenta also, the pain will be there, and the pain is as sharp as a stabbing sensation. 14th question is, while the client is in active labor with the twins and the cervix is 5 centimeters dilated, the nurse observes the contractions occurring at a rate of every 7 to 8 minutes in a 30 minutes period. Which of the following would the nurse most appropriate action? There must be like after 6 centimeters dilatation, the person should get more than this time. That means the contraction should stay at least for 7 to 10 minutes, and the intention should be more, but here it is less intention is there, and the duration also less is there, maybe like it is hypo contractility is there. So here let us see the options here. So note the fetal heart rate and patterns. Notify the physician immediately. Administer oxygen at 6 liters by mask and have the client push below during the contractions. The answer is notify the physician immediately, because the nurse should contact the physician immediately, because the client is most likely experiencing hypotonic uterine contractions. That contractions are not so uh, good to get the dilatation of the 10 centimeters of the cervix. So these contractions tend to be painful but ineffective. The usual treatment is oxytocin augmentation unless cephalopelvic disproportion exists. So if cephalopelvic disproportion is not there in this case, to augmentation is nothing but to increase the uterine contractions. The oxytocin we can administer to the patient. By that it increases the uterine contractions and also the cervical dilatation. The 15th question is, a client tells the nurse, I think my baby likes to hear me talk to him. When discussing neonates and stimulation with sound, which of the following with the nurse includes as a means elicit the best response? Means it is very important to speak to the neonates. So with which pitch we should speak? So A1 is high pitched speak with the tonal variations, low pitch speech with the S, sameness of tone, cooling sounds rather than words, repeated stimulation with loud sounds. High pitched speech with tonal variation is the answer. Providing stimulation and speaking to the neonate is important. Some authorities believe that the speech is the most important type of the sensory stimulation for the neonate. So sensory stimulation for the neonate, it is not only the belief, it is the speech is the sensory stimulation. So the neonates responds best to speech with the tonal variations. We should change the variation, we should have the tonal variations up and down and with the high pitch voice. The neonate can hear the louder sounds, that is above the 55 decibels. Above the 55 decibels. If it is below the 55 decibels, the neonates cannot hear. So to speak with them, we should have high pitched voice that should be above the 55 decibels. Thank you for watching. Please like, subscribe and share my channel. Those who want knowledge regarding the NCLEX RN and also the AIMS based questions, these are all. Thank you very much.